Alrighty, so some goals and objectives for this program. My goal was to provide breast cancer patients, survivors, and caregivers with tools, knowledge, and confidence to effectively advocate for themselves and their loved ones throughout every stage of care. And a couple of my objectives: by the end of the program, participants will be able to assess their personal communication barriers and the challenges that they face in advocating for themselves. And by the end of the program, participants will have received an advocacy card that will serve as a cheat sheet with a list of different questions to ask their providers, assertive communication phrases, self-advocacy statements and affirmations, and their rights as a patient. So, what is self-advocacy? The very simple definition is speaking up for yourself and communicating your needs in regard to your health and your health care. So, self-advocacy can look like a few different things. So, it can look like coming to our appointments prepared. This could include having our symptoms or any concerns that we may have, any updates for our providers written down in one space. And it can also look like having any questions that we think of before our appointment written down for us to ask our provider and kind of revert back to so we don't forget. Or it could even look like simply arriving to our appointments 10 minutes early to get settled in and calm our nerves before the actual appointment starts. It can also look like asking questions, and it is okay to ask our doctor to rephrase a statement that they may make, or when they're giving a diagnosis, to ask them to put that into simpler terms. Because a lot of medical terminology, it's hard to understand sometimes. So just asking them to rephrase it so that way we can understand and be informed about our care. And it is our right to get clear answers and to understand every aspect of our care. It could also look like taking notes. So you could even bring a small notebook. I know Going Beyond the Pink provides little notebooks in our care bags. So even bringing that to your doctor's appointment, so that way you can write down things that your doctor may discuss during an appointment. Can help us, again, remember things at a later time if we, need time to think or want to revert back to what they said. Self-advocacy could also look like bringing someone there to be of support to you during your appointment. So having someone that we trust that's present not only provides comfort for us, but it can also serve as a reminder of what to say or what was said during our appointment. So say, you forgot to bring a pen and a little notebook to write down the important information that your doctor was giving you about your care or your diagnosis or treatment. Having a second set of ears is really impactful because they may remember things that we don't in the heat of the moment. Self-advocacy can also look like seeking a second opinion or switching providers. I know that here in our workshops, we've talked about either not feeling comfortable with our providers, or they didn't provide us with the care and the empathy that we needed. So it is okay to search another provider if you don't feel comfortable or feel like it's not the right fit, or seeking a second opinion, because everyone has different experiences and different expertise. And self-advocacy also looks like practicing, and we will get into ways that we'll be able to practice our self-advocacy later in this presentation. So, why is self-advocacy critical in healthcare? So we can discuss why it is essential. Self-advocacy has been found to lead to better health outcomes. Research specifically has found that patients who advocate for themselves tend to stick to their treatment plans, they'll experience fewer complications, and they feel more satisfied with the care that they've received overall. By being a self-advocate, we are actively contributing to our healing. Self-advocacy can build confidence, which we will also get into later in this presentation. When we take charge of our health by asking questions or expressing concerns, we give ourselves the power, and helps us feel more empowered. And then finally, advocating for ourselves can help to strengthen our relationship with our doctors. So, of course, if you find a provider that you do feel comfortable with and want to continue pursuing them, having open and honest communication with our doctors helps them to better understand our needs and our preferences and what concerns that we have. And yes. So let's advocate for care that truly fits us and our needs rather than just accepting a standard procedure. So, a little bit about knowing your rights as a patient and survivor. You have the right, and this has been touched on a little bit, but you have the right to ask questions and get clear answers from your providers. So, asking questions that helps us understand our diagnosis can allow us to make informed decisions about our care. You have the right to be involved in decisions about your care. So, this allows you to have control over the care that you receive. And at the end of the day, doctors, they go to school and they know about the body. And one of our survivors that has came to our wellness workshop has talked about this, but we know what's best for our body. They don't know what's best for our specific needs in our specific body. You have the right to request a second opinion. Getting a second opinion can help to make you feel confident in your diagnosis and treatment options and ensures that we're choosing the right provider for us. You also have the right to bring a support person to your appointments. And as I mentioned earlier, having a second set of ears can help to listen for important information and overall can help make us feel comfortable throughout our appointments. And we also have the right to refuse or stop treatment. We have the right to change our mind at any time about our care because consent is ongoing. So I have provided a few key questions to ask our doctors. So, whenever we are undergoing diagnosis and are wanting to understand the disease a little bit better, some good questions would be, what type of breast cancer do I have and what does that mean? What is the stage and grade of my cancer? Has the cancer spread to my lymph nodes or anywhere else? And what do my hormone receptor and HER2 test results mean for my treatment? And then we will go into treatment and side effects. Some good questions to ask our doctors would be, what are my treatment options and what are the pros and cons of each? How long will treatment last? Will I need surgery, chemotherapy, radiation, or hormone therapy? Can I delay treatment for a second opinion or to consider other options? What short-term and long-term side effects should I expect and how can I manage them? How will treatment affect my fertility, menopause, or my bone health? And what are the signs of complications that I should watch for? And to continue on to key questions to ask our doctors. In regard to care coordination and support, some good questions would be, who will be a part of my care team? Can I meet with a social worker, counselor, or nutritionist? How can I reach someone if I have questions in between my appointments? Are there survivorship care programs or support groups that you would recommend? And are there patient navigators or advocates who can help me? And some key questions in regard to follow-up care and monitoring. You could ask, what does follow-up care look like after treatment ends? What long-term side effects should I be watching for? How often should I get follow-up screenings and what should those include? And what are the signs of recurrence and what should I do if I notice changes? So next we will come into communicating with confidence. So for many of us, it can be really intimidating to speak up in medical settings because it's, like I said, intimidating. But one of the most powerful tools that we have is our voice. So communicating with confidence doesn't mean that we have to know all of the answers, but it means that we feel empowered to ask our providers the right questions and express concerns that we may have and ask for further clarification. A few different things for us to remember is that confidence starts with our mindset. We are the experts when it comes to knowing our bodies. We know when our bodies don't feel like they're normal. So it's very important for us to trust our instincts and to speak out when something does not feel right. A few different things for us to remember is that our words and thoughts are powerful. So trying to refine our dialogue or our thoughts is very powerful. So instead of saying, I don't want to be a burden, or, I don't want to be difficult, try to say instead that I deserve to be heard. My concerns deserve to be heard. Or instead of thinking or saying, oh, well, the doctor knows best, they're the expert, you can try saying, this is a two-way conversation that I have a right to contribute to. And while our verbal communication is important, our nonverbal communication is just as important. We can show confidence through making eye contact with our providers, having an open posture, and even by bringing in notes or a list of questions to ask our providers. And the more that we practice communicating assertively or clearly about our care, the more confident that we will feel within ourselves, which is, of course, the whole point in the self-advocacy training, is for us to feel more confident. So, some take-home tools, and I believe that this will be emailed to everyone that is participating today. And Kara is also going to be having these rack cards that I designed printed out, so they'll also be available in the Going Beyond the Pink office. So this is another part of my project and a part of another project that I had to do for my semester. I designed self-advocacy rat cards, which is the little form that I had sent out just to get some ideas of what everyone needed a little bit more guidance on or needed a little bit more support with. So it has some features of key questions to ask your doctor that we went over. So that includes your diagnosis and understanding the disease, treatment and side effects, care coordination and support, and then follow-up and monitoring. It also includes some assertive communication phrases, and it also includes daily self-advocacy and affirmations that you can repeat to yourself. And it also will include your rights as a patient. This was something that I was very excited about because growing up, I had a mom that always advocated for my care as a woman. And I think as a woman, it's very important because people will just kind of brush off our concerns or, any complaints, so to say, that we may have as being dramatic or, they don't take us seriously. So I thought that the self-advocacy was very important. And then that is all that I have. So thank you again, everyone, for joining and for listening to my presentation. And thank you as well for participating in the survey that I had sent out because you helped to shape this.